Hello friends, in today's video I will be going over vital signs. We will discuss what the vital signs are, methods of obtaining vital signs, and other considerations that are specific to certain vitals. So what are the 6 important vital signs? There's blood pressure, pulse, temperature, oxygen saturation, respirations, and one that some people tend to forget, pain. Let's start off with blood pressure. Blood pressure has 2 numbers, the systolic value and the diastolic value. For example, 120/80, which is also what is considered a normal blood pressure. The systolic value measures the pressure in the arteries exerted by the heart during heartbeats, and the diastolic value measures the pressure in the arteries between heartbeats. And the difference between the systolic number and diastolic value gives you the pulse pressure, which is 40. 120 minus 80 equals 40. This number can be used by healthcare providers to predict or spot possible problems in the circulatory system. So how do we take a blood pressure? We can either use a machine to take a blood pressure or take it manually. It's really important to know how to take a manual blood pressure just in case we need to double check a machine's reading of a wacky blood pressure or if we don't have access to a machine. You can also take a blood pressure from multiple different extremities, but since the most common is the arm, that is the one I will be covering in this video. Let me know down below if you would like to know about any of the other extremities as well. I'm going to start with a quick chat about the size of your blood pressure cuffs. The recommendations for selecting the best cuff size are as follows. Width-wise, the bladder of the cuff should cover at least 40% of the arm circumference, and lengthwise, the bladder of the cuff should cover at least 80% of the arm circumference. And the area of the arm we are referring to is the area between the elbow and shoulder. What the heck does that mean? Let's look at it visually. Let's say that this is the whole cuff. The bladder is inside of the cuff, and it's the portion that inflates. The circumference of your arm we want is this area, between your elbow and shoulder. So if this is 100% of your arm circumference, the bladder needs to cover at least 80% of it lengthwise and 40% of it widthwise. So based on your patient's size, you can choose the correct cuff size using the 80-40% rule to get the most accurate blood pressure reading. And like I mentioned, you can either use a blood pressure machine to take a blood pressure or do it manually. To take the blood pressure with a machine, you choose the correct cuff size, wrap it around the arm tightly, paying attention to the artery marker, which needs to be placed over the brachial artery, then press start on the machine and wait for the reading to pop up. It should look something like this. When it comes to taking a manual blood pressure, you're going to need a special cuff with a gauge and bulb, as well as a stethoscope. And once again, you're going to choose the right cuff based on the patient's size, wrap it around the arm, paying attention to the artery marker, ensuring that the brachial artery and the marker align, and it should look like this. Then you're going to go ahead and find the patient's pulse on the same arm, preferably using the brachial artery. Then start inflating the cuff with the bulb until you can no longer feel their pulse. Take note of the number on the gauge when this happens, because this number is going to be your estimated systolic number. I will also go over a pulse next, so if you're not quite sure what I mean, the overview of the pulse is coming up next. Now, with the estimated systolic number in mind, you're going to inflate the cuff once again, but 30 millimeters of mercury higher than the estimated systolic number. For example, if you felt the pulse disappear when you got to 110 millimeters of mercury, you're going to inflate the cuff to 140 millimeters of mercury. So you will place your stethoscope on the brachial artery. Obviously, you'll have the earpieces in as well. Then you're going to inflate the cuff to 30 millimeters of mercury higher than your estimated systolic reading. Then begin to deflate at a rate of 2 millimeters mercury per second. The number that corresponds to the first sound you hear is the systolic number, and the last sound you hear will be the diastolic number. For example, if you start at 140 millimeters of mercury, and then the first sound you hear is at 112 millimeters of mercury, and if the last sound is at 78 millimeters of mercury, then the blood pressure is going to be 112 over 78 millimeters of mercury. And before we move on to pulse, I'm going to give you a few guidelines and considerations when it comes to measuring blood pressure. Number one is the importance of choosing the correct cuff size. If you choose a cuff that is too small, your blood pressure reading is going to be falsely high, and if you choose a cuff size that is too big, the blood pressure reading is going to be falsely low. And number two is the position of the arm. It needs to be positioned at heart level, and it needs to be kept still. Having it higher or lower than the heart, or not having it still, could give you an incorrect reading as well. Number three is very important. Do not use an arm that has a fistula, a running IV, or the arm that's diseased or injured, or the arm that's on the side on which a mastectomy has been performed. This is dangerous for the patient and it could lead to complications. And number four, ask the patient not to talk while you're taking their blood pressure, because it's going to lead to an incorrect reading as well. So let's jump over to pulse now. A pulse is typically a measurement of your heartbeat and how many times in a minute it beats. The normal heart rate or pulse is 60 to 100 beats per minute. There are a bunch of different locations that you can use to take a pulse, and most of them can just be palpated with your fingers. You want to use your pointer and middle finger when assessing pulses, like in this picture. So the 5 locations that are used most often are the carotid, apical, brachial, radial, and pedal. The apical pulse requires a stethoscope, and you're basically listening to the heart itself and counting the beats per minute. And if the pedal pulses are too hard to feel, you can use a portable Doppler ultrasound to locate them. Now, the best way to practice finding these pulses is trying to find them on yourself first. So pause the video if you'd like to try and find your pulses. And in addition to counting beats per minute, you're also assessing the pulse's strength, whether it's beating in regular or irregular intervals, and comparing the pulse you get on the right side of the body with the pulse you get on the left side of the body. And before moving on to temperature, these are a couple of guidelines for measuring your patient's pulse. Number 1, don't feel for the carotid on both sides of the neck at the same time. You could stimulate the vagus nerve and decrease blood flow to the head, which could literally make someone pass out. Then number 2 is when you're counting someone's pulse and you notice that it's irregular, you can no longer use the count for 10 seconds multiplied by 6 or count for 30 multiplied by 2 trick, because you will get an incorrect rate per minute. Next up, we have temperature. It's pretty self-explanatory. The temperature vital sign measures your temperature. The average temperature is 37 degrees Celsius, but the range is between 36.4 to 37.4 degrees Celsius. The most common routes for taking the temperature is temporally on the forehead or orally in the mouth. But there's also axillary, which is in the armpit, tympanically, which is in the ear, and rectally, which is in the rectum. To take the temperature temporally through the temporal artery site, use the thermometer probe and go across the forehead while holding down the button until you're done sliding the probe. And to take the temperature orally, place a disposable cover over your oral thermometer and place it under the tongue, then ask the patient to close their mouth and wait for the reading. I have one consideration for temperature before we move on to oxygen saturation. If the patient is sweating while you're taking the temporal temperature, wipe the forehead first and then go across the forehead and tap the thermometer to the back of the patient's ear. This is going to give you a more accurate measurement of the temperature. So the oxygen saturation of your patient is a reading of their hemoglobin. It's a percentage that tells you how much oxygen saturated hemoglobin the patient has, and the normal percentage is between 95 to 100%. Typically, the oxygen probe is placed on the patient's finger and left on to give a reading. Other than a finger though, you can also measure the oxygen by placing the sensor on the toes or the earlobe. So the first consideration for oxygen saturation is anemia, nail polish, and any peripheral vascular disorders can impact your oxygen saturation readings. And second, you need to ensure that there's a proper probe placement. If the probe is halfway off of the finger, you could get a falsely low reading. The fifth vital sign is respirations, which refers to the act of breathing in and out to exchange oxygen and carbon dioxide in the lungs, and it's measured as respirations per minute, and the normal respirations per minute is between 12 and 20. And similar to the pulse, other than the rate of respirations, you'll need to assess the pattern and the depth of breathing. The one consideration I have for respirations is to do it following the pulse count. Sometimes patients alter their breathing pattern when they know someone is watching them breathe, and this could give you a false number. Our last vital sign is pain. And pain is unique to everyone you meet. Some people have a high pain tolerance, some people have a low pain tolerance, and in healthcare, pain is what the patient says it is. If the patient appears cool and calm but is reporting 10 out of 10 pain, you take their word for it. There are a few ways of assessing pain. There is the numerical way from 0 to 10, a descriptive way, a visual way, where they choose a spot on a blank line from no pain to worst pain possible, and then there's the faces way. Finally, the considerations for pain are as follows. Be aware of different cultures. In some cultures, you can't display your emotions outwards, and this could mean having no verbal indicators of pain. So be on high alert for nonverbal indicators of pain, which brings me to my second consideration. Nonverbal indicators are not just used with babies who can't talk. They are also used with patients who have cognitive disorders such as dementia as well, so pay attention to them and consider pharmacological or non-pharmacological pain treatments. Finally, the patient's pain goal may not be zero pain. Sometimes the baseline for someone's pain is higher than 0 and they require treatment to bring their pain level back to baseline, whether that's 3 out of 10 or 6 out of 10. Thank you for watching. Please like and subscribe.